Dr. Klein, what are some of the common challenges that occur for patients with autism spectrum disorder in the emergency department?
So patients and their families have a lot of issues when they come into the ED. Kids cannot sit still for very long. They need to be in a quiet space. They need to be seen quickly, and that doesn't happen in the emergency department. And I think families also don't understand why kids aren't being seen more quickly because of the challenges that they're having. And it's very difficult in the ED because we try hard to see these kids as fast as we can. There's often a huge number of other children in the ED, some of whom have higher acuity, meaning have a higher level of illness, and really require to be seen before a child potentially with autism. That makes it really difficult for families. And I think when they come in with an understanding of what's going to happen, that really helps. That they're going to walk into the ED, the triage nurse is going to see them, going to measure their level of acuity, how sick they are, and help to determine when they can be seen in the ED. But the challenges don't go away. Long waits, stressful environment, and a loud environment. And also their kids getting into stuff in the rooms because the rooms are made so that any patient who comes in the ED can be seen in those rooms. And there are things that kids can get into. We do have a few mental health rooms which have some safe spaces and cabinets that close off materials, but those rooms are often filled with patients with other types of problems and behavioral issues.
What are some of the common challenges that occur in the emergency department for providers serving these kids?
So I think for providers, the challenges are sort of similar. When a family comes in and lets us know that their child has special needs, that their child has autism and has a hard time waiting or has a hard time dealing with a stressful or loud environment, we really want to meet those needs. It's challenging to not be able to meet those needs right away. So that is a problem for staff. And then competing demands. There are a lot of patients in the emergency department. Nurses may cover 2 to 4 patients at a time. Attending physicians may cover 10 to 15 rooms at a time. So they're really seeing a lot of patients. And then there's the residents who are trying to get in there as fast as they can, the junior physicians. So there are people who are available to see your children, but the problem is sometimes they have other kids they need to see first, which again frustrates them because they want to meet your needs and they understand how difficult it is for you to be in a room with a child who is constantly getting into things that potentially you're worried about could be unsafe for them.